Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been struggling a lot with my breathing lately, especially when I'm trying to climb stairs. Even with the oxygen, it feels like it's not enough sometimes.
I understand that must be quite difficult for you. Tell me more about when you notice the dyspnea is at its worst.
Well, any physical activity really sets it off. But stairs are the worst. I can hardly make it up without having to stop and catch my breath. Even at home, I need to use the supplemental oxygen, but I feel like maybe it's not set right, or maybe I'm just getting worse.
It's good that you're using the oxygen as prescribed. We can definitely look into optimizing it. How about at night? How are you managing with your CPAP?
The CPAP is a whole other story. I've been using it every night, but I still wake up feeling like I haven't slept at all. Since my time in the service, my sleep has never been great, but it feels like it's getting worse. I'm tired all the time.
That sounds really tough. Sleep is so important to your overall health, especially with your other conditions. Speaking of which, how have your blood pressure and diabetes been?
My blood pressure's been up and down. I admit I sometimes forget to take my evening pills. My diabetes hasn't been great either. I was in the hospital a while back, and it threw my whole routine off. My last A1C was 9.3, and I know that's not good.
I see. We need to find a way to help you remember to take your medication consistently. That might help stabilize your blood pressure. Regarding your diabetes, we can work on getting you back on track. Have you been having any other symptoms? Pain? Discomfort?
Yes, actually. I've been having this mild chest pain. It's been there for a long time, but it never really goes away. It bothers me, especially with everything else that's going on.
We'll definitely look into that. Have there been any issues with your inhalers or other respiratory medications?
Yes, one of my inhalers, the albuterol, it feels like it's not working at all. I press it, and nothing seems to come out. It's frustrating when I'm struggling to breathe.
That must be concerning. We'll have a pharmacist check that inhaler for you. You mentioned some concerns about allergens in your home environment.
Oh yes, the carpet in my apartment seems to be making things worse. I think it might have mold because I get worse when I'm at home, and I'm still smoking a little, which I know isn't good.
Addressing your home environment and continuing to cut down on smoking will be crucial. We'll also explore some options for more portable oxygen and a home nebulizer to help manage COPD more effectively. Now, about the parking placard and your medications. Are they being sent to the right address after your move?
That's another problem. Since I moved, there's been some confusion about where things are supposed to go. I'm worried about getting my medications on time.
We'll make sure to update your records and get everything sorted out for your address. Let's summarize what we have from today and our next steps.
Please go ahead.
From what you've described and the clinical values, your COPD remains a significant concern, particularly your dyspnea and the effectiveness of your current oxygen therapy. We'll reevaluate the oxygen settings and make sure your inhaler is working properly. Your sleep apnea treatment with CPAP needs review, possibly with a sleep specialist, to see why it's not improving your rest. Your blood pressure and diabetes management need closer monitoring, especially given the recent instability in your readings and the increase in your A1C. We'll need to address your medication adherence, perhaps with reminders or a pill organizer. For your chest pain, I'd like to do some further testing to understand the cause better and ensure we're not missing anything. We'll also conduct a home environment assessment to see if there are any allergens or irritants like mold that could be exacerbating your respiratory issues. Lastly, we'll look into more advanced respiratory support equipment and ensure all logistical issues regarding your medications and disability access are resolved. Regular follow-ups will be essential to adjust your treatment plan as needed and monitor your progress.
Thank you, Doctor. I appreciate you taking the time to go through everything. It's a lot, but it sounds like we have a plan moving forward.
Absolutely. I'm here to help you manage these conditions and improve your quality of life. We'll tackle these issues one step at a time.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been struggling quite a bit with my health recently, especially with my breathing. It's been getting worse, probably because of my smoking. I've cut down significantly, but I know I need to quit entirely. It's tough, though. Also, my knees have been hurting more. Maybe it's the osteoarthritis you mentioned last time.
It's good to hear that you've reduced your smoking, but quitting entirely is definitely a crucial step for your health, especially considering your respiratory symptoms and past heart issues. How have you been managing the pain in your knees?
I've been trying to stay active, but some days the pain makes it hard to move much. I take over-the-counter painkillers when it gets bad. I've been more concerned about my breathing, though. Sometimes I feel short of breath, even with minimal exertion.
We've noted your symptoms, and the pulmonary function tests show that your lung capacity is indeed reduced. It's likely exacerbated by smoking, as you mentioned. Let's also keep in mind your heart's history and the stress it may be under due to your other conditions like high blood pressure and diabetes.
Yes, about my diabetes. I've been monitoring my blood sugar levels and taking insulin, but it seems like it's a constant battle to keep it under control. And I'm still waiting on my hypertension meds. You mentioned lisinopril last time.
That's correct, and it's important we start you on lisinopril soon to manage your blood pressure effectively. Managing your diabetes is also crucial. Your current HbA1c shows that your blood sugar levels have been higher than we'd like over the past few months.
I've been trying to eat better and exercise when I can. It's just hard with my knees and feeling winded so easily. And I'm worried about my heart, knowing there was a heart attack I didn't even realize happened.
It's understandable to feel overwhelmed with all these health issues. Let's make sure we address each one step by step. For your heart, maintaining control of your blood pressure, cholesterol, and diabetes is key, as well as quitting smoking. Regarding your cholesterol levels, they've been good, but we must keep monitoring them, given your history and other risk factors.
I've also been thinking about the colonoscopy you mentioned. I know it's important, but I'm worried of prioritizing too many things at once.
It's wise to prioritize, especially with your current health concerns. We can defer the colonoscopy until we have better control over your more immediate issues like smoking cessation, diabetes, and blood pressure.
That makes sense. What about my eyes? The last check wasn't great, and I know diabetes can affect that too.
Yes, keeping your diabetes under control is part of protecting your vision. We'll arrange a follow-up with the ophthalmologist to ensure we're not missing anything and to adjust your treatment as needed.
And the vaccines. I got the flu shot and the pneumonia vaccine, right? Should I be considering any others?
You're up to date with your flu and pneumonia vaccinations, which is great. There aren't any additional vaccines needed at this moment, but we'll keep that in mind during your routine checkups.
Thank you, doctor. It feels like a lot to manage, but having a plan helps.
Absolutely. And remember, I'm here to help you through this. Let's go over your plan based on today's assessment. We'll start you on lisinopril to help manage your hypertension. Continue with your insulin and monitor your blood sugars closely. We need to get your HbA1c lower to reduce the risk of complications. It's imperative we tackle this. I suggest setting a quit date, and we can discuss using nicotine patches and possibly Chantix to help. Continue with mild exercise as tolerated, and use NSAIDs for pain management. We'll also keep an eye on the progression of your osteoarthritis. Regular monitoring and adherence to your medication regime are key. We'll also keep an eye on your cholesterol and triglyceride levels. We'll continue to monitor your lung function and symptoms. Smoking cessation is likely to have a significant positive impact here. Schedule a follow-up with the ophthalmologist to address the concerns from your last examination. Let's schedule a follow-up in 3 months to assess progress and make any necessary adjustments. Meanwhile, please reach out if you have any concerns or new symptoms.
Thanks, doctor. I appreciate the clear plan and the support.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've been reviewing your recent symptoms and tests, and it seems there's been some progression in your tremors and rigidity. How have you been feeling overall?
Honestly, it's been challenging. The tremors have gotten worse, and I feel slower than usual. My daily tasks are becoming more difficult.
That's consistent with what we're seeing on your evaluations. With Parkinson's, these changes are expected over time, but we can adjust your treatment to help manage these symptoms better. Have you noticed any side effects from the current medications?
I've felt a bit nauseous, and I think my sleep is affected too.
It's important to manage these side effects as well. I can prescribe something for the nausea and adjust your medication timing to possibly help with your sleep. Let's also explore adding physical therapy to your routine, which can significantly benefit your mobility and balance.
Would that help with the stiffness as well?
Absolutely. It's very effective for managing stiffness. We'll monitor your symptoms closely and adjust as needed. It's all about maintaining your quality of life.
Now look at question 26.
I see you've been prescribed a new dosage for your hypertension medication. It's important to adjust gradually to monitor how your body reacts. Have you started the new dose yet?
I haven't. I was actually a bit concerned about changing it. What should I be looking out for?
You'll want to watch for any signs of dizziness, headache, or feeling unusually tired. These could be signs that the dose might be too high. Also, keep an eye on your blood pressure readings.
What's the best way to track those changes?
You could keep a log of your blood pressure readings at home. Take them at the same time each day and bring this log to your next doctor's appointment. This will help your doctor understand how the new dosage is working for you.
That sounds manageable. What if I experience any of those side effects?
If you notice any severe symptoms, contact your doctor immediately. Otherwise, we can discuss slight adjustments, but only after consulting with your physician.
Now look at question 27.
Today, we'll discuss the critical importance of comprehensive mental health treatment and the role of support systems. Mental health conditions affect millions, yet many do not receive the care they need due to stigma or lack of resources. It's essential that we advocate for better access to care and educate our communities about the importance of mental wellness. Integrated treatment approaches combining therapy and community support show the best outcomes. We must push for policies that fund mental health services and reduce barriers to accessing care. Each individual's path to recovery is unique, and our systems must be flexible to accommodate these needs. Lastly, let's not forget the power of community and peer support. These networks can provide critical emotional backing and practical help, making a significant difference in recovery. Let's work together to ensure no one has to face mental health challenges alone.
Now look at question 28.
Let's quickly address the medication error that occurred this morning. First, it's vital we all understand the sequence of events to prevent future mistakes. Can someone recap what happened?
The patient was administered a higher dose of sedative than prescribed due to a miscommunication. The label was unclear, and the dosage was miscalculated.
Thanks for clarifying. It's crucial we double-check medication labels and dosages, especially in high-stress environments like the OR. We'll implement a two-person verification for all sedative administrations moving forward.
I agree. That should help. Also, perhaps we should consider additional training on drug concentration calculations to ensure everyone's on the same page.
Excellent suggestion. I'll arrange a training session next week. Let's all commit to being extra vigilant and communicating clearly to avoid such errors. Patient safety is our top priority.
Now look at question 29.
We've seen an increase in child pneumonia cases this winter. It's important we all understand the comprehensive management approach, starting with accurate assessment and timely intervention.
Absolutely. Monitoring oxygen saturation and ensuring they're maintaining adequate hydration are critical. What's the protocol for antibiotic administration?
For bacterial pneumonia, antibiotics are crucial. We must adhere strictly to the prescribed course to prevent resistance. Also, educating parents on the signs of deterioration and when to seek further help is vital.
I think reinforcing our training on respiratory support techniques could also benefit the team. Sometimes these cases can escalate quickly.
Good point. Let's schedule a refresher on that and ensure everyone's comfortable with the equipment and procedures. Keeping these kids stable and comfortable is our primary goal.
Now look at question 30.
Navigating surrogacy arrangements can be particularly complex for same-sex couples. It's not just about the legal aspects, but also ensuring the emotional and ethical considerations are addressed.
Exactly. The legal framework varies significantly from one jurisdiction to another, which can affect everything from parental rights to surrogacy agreements. It's crucial for couples to seek specialized legal advice early in the process.
And from an ethical standpoint, the rights and well-being of the surrogate must always be a priority. It's important that there's transparency and a mutual understanding of the expectations and commitments involved.
Absolutely, ongoing communication is key. Also, considering the psychological support for all parties involved can help manage expectations and reduce stress throughout the process.
That's a great point. Offering counseling and support groups can be very beneficial. This journey is about creating families, and ensuring a positive, respectful process for everyone involved is essential.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good morning, everyone. Today, we will delve into the intricacies of palliative care communication, particularly focusing on advanced liver disease. This session is rooted in a comprehensive understanding of the multidisciplinary approach required in managing complex cases that require both medical and emotional support. Let's consider a case that recently came to my attention during my tenure at a major healthcare facility. The patient, whom we'll refer to as Mr. Allen, was a 57-year-old male diagnosed with end-stage liver disease due to chronic hepatitis C infection. He was a potential candidate for liver transplantation, but was also grappling with significant comorbidities, including diabetes and chronic kidney disease, which complicated his eligibility for the transplant list. Mr. Allen's case was particularly challenging due to his rapid decline in health. He experienced recurrent ascites requiring frequent paracenteses, encephalopathy that impaired his cognitive functions, and severe fatigue. His quality of life was diminishing swiftly, and he was becoming increasingly dependent on his family for daily activities. Upon reviewing Mr. Allen's case, it became evident that there was substantial lack of communication regarding the progression of his illness and the realistic outcomes expected. This gap significantly impacted the patient and his family's ability to make informed decisions about his care and future. In one of our initial meetings, after taking over his case, I began by asking Mr. Allen about his understanding of his condition. This open-ended question is crucial as it not only informs us about the patient's level of knowledge, but also opens the door to gauge his emotional and psychological readiness to discuss his prognosis. For example, his response was along the lines, "I know my liver is failing, and I've been told that a transplant could save my life, but I'm scared about the operation and what happens if I don't get a transplant." And I told him, "Thank you for sharing that, Mr. Allen. It's completely normal to feel scared. Let's talk about what liver failure means and the potential paths forward, including the transplant and other ways we can manage your symptoms and improve your quality of life if a transplant isn't possible right away." This approach, which is grounded in patient-centered care, allows the patient to feel heard and understood and not just a subject of medical procedures. We discussed the unpredictability of his condition and the potential for rapid changes in his health status. It was important to prepare Mr. Allen and his family for all possible outcomes, which is a core aspect of effective palliative care. During subsequent visits, we focused on detailed discussions about symptom management, the importance of maintaining nutritional status, and managing his diabetes and kidney issues in the context of his liver disease. We also introduced Mr. Allen to a social worker who helped address his psychosocial needs and provided support to his family. The turning point in our communication came when I introduced the concept of a goal-concordant care plan. This plan was developed through multiple conversations where we discussed what Mr. Allen valued most about his life and his care preferences at different stages of his illness. For instance, a response like, "Mr. Allen, based on what you've told me about your values and preferences, let's outline a care plan that respects your wishes and focuses on what's most important to you. This includes managing your symptoms effectively, avoiding unnecessary hospital visits, and spending as much time as possible at home with your family." By documenting these conversations comprehensively in Mr. Allen's electronic health records, we ensured that any healthcare provider who interacted with him could understand his preferences and the agreed-upon plan. This continuity of care is critical in managing complex cases and ensuring that all team members are aligned with the patient's goals. Mr. Allen's case underscores the necessity of integrating palliative care principles into the management of chronic illnesses. It highlights the importance of communication, understanding the patient's value system, and building a care strategy that aligns with their personal goals and clinical needs. These conversations are not just about managing the illness, but are also about enhancing the quality of life and dignity at the end of life. Thank you for your attention. I hope this discussion will inspire you to incorporate these practices into your clinical work to improve both patient outcomes and satisfaction.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, I'll be delving into the mechanisms, applications, and the critical management of immune-related adverse events, or IRAEs, associated with these therapies. Let's begin by understanding the fundamental science behind immune checkpoint inhibitors. Immune checkpoints are molecules in the immune system that either turn up a signal, co-stimulatory molecules, or turn it down, inhibitory checkpoint molecules. In cancer, certain inhibitory checkpoints are often activated to prevent the immune system from destroying cancer cells. Checkpoint inhibitors are drugs designed to block these inhibitory checkpoints, thus allowing immune cells to attack cancer more effectively. The most well-known checkpoints inhibiting the immune system include CTLA-4, cytotoxic T lymphocyte-associated protein 4, and PD-1, programmed death 1, along with its ligand PDL-1. The inhibition of these checkpoints has shown remarkable success in treating various cancers, including melanoma, non-small cell lung cancer, and renal cell carcinoma, to name a few. However, the activation of the immune system can sometimes be too broad, leading to immune-related adverse events, or IRAEs, which can affect any organ system, but most commonly impact the skin, gastrointestinal tract, liver, endocrine system, and lungs. To illustrate these points, let's consider a case study that highlights both the potential and the challenges of checkpoint inhibitor therapy. We have a 54-year-old male patient diagnosed with advanced melanoma. The patient started treatment with ipilimumab, a CTLA-4 inhibitor, and nivolumab, a PD-1 inhibitor. Initially, the patient responded well to the treatment, showing significant reduction in tumor size and improved physical condition. However, approximately 8 weeks into treatment, the patient began experiencing severe diarrhea, a common IRAE associated with these therapies. His condition was initially managed with loperamide, but he showed no improvement and was admitted to the hospital. On admission, his laboratory tests indicated elevated inflammatory markers and a colonoscopy confirmed grade 3 colitis. This case underscores the necessity for vigilant monitoring and prompt management of IRAEs. Treatment for IRAEs typically begins with high-dose corticosteroids to suppress the immune response. In our patient's case, intravenous corticosteroids were administered. His symptoms improved significantly, and he was able to resume his cancer therapy on a lower dose after a careful reassessment of his overall health and cancer progression. Now, while corticosteroids are effective, they can themselves cause side effects, including an increased risk of infection. This necessitates a balance between managing IREs and maintaining effective cancer control. The decision to resume therapy after an IRE requires careful consideration of the severity of the event, the overall benefit of the immune therapy, and the patient's health status. Moreover, in managing IREs, interdisciplinary cooperation is crucial. Oncologists often collaborate with gastroenterologists, endocrinologists, dermatologists, and other specialists to provide comprehensive care for patients experiencing these complex side effects. Research continues to evolve in the field of checkpoint inhibitors. Future directions include identifying biomarkers that predict susceptibility to IRAEs, which would help personalize treatment and minimize risks. Furthermore, combination therapies that include checkpoint inhibitors are being tested to enhance cancer control while possibly reducing the incidence of severe IRAEs. While immune checkpoint inhibitors represent a breakthrough in oncology, they come with their own set of challenges, particularly in the management of IRAEs. The ongoing development of strategies to mitigate these adverse effects, alongside the dynamic collaboration across specialties, underscores the complexity and the promising future of cancer immunotherapy.